Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Metolazone, or its brand name, Zaroxolyn. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications, or reasons we would not be able to prescribe Metolazone. Then discuss examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Metolazone is a diuretic and antihypertensive agent, meaning it lowers blood pressure. It belongs to the class of medication known as the quinazolines, and it primarily inhibits the sodium reabsorption at the distal convoluted tubule. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of hypertension or high blood pressure, as well as in the treatment of edema associated with kidney disease or congestive heart failure. With respect to contraindications or reasons we would not be able to prescribe Metolazone, we wouldn't give this medication to a patient who had a hypersensitivity to Metolazone or any other component of the formulation. If a patient was experiencing hepatic coma, they would not use this medication, as well as anuria, which would be the inability of the kidneys to produce urine. Now for some examples of dosing with Metolazone. So in the treatment of hypertension, we may see an initial dose between 2.5 and 5 milligrams orally once daily. You would then titrate the dose or increase the dose to therapeutic response and then use the lowest possible dose to maintain therapeutic effect. In the treatment of edema, the initial dose may be higher at 5 to 20 milligrams orally once daily. And again, you would titrate the dose to therapeutic response and try to use the lowest possible dose to maintain that therapeutic effect. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Metolazone, so we'll go over some of those here now. Some patients may experience orthostatic hypotension, which will be a sudden drop in blood pressure when going from a seated to a standing position. Some patients may experience abnormal electrolytes, or hyperuricemia, and dizziness and fatigue are also common side effects. Now, some more rare but serious side effects would be pancreatitis or Stevens-Johnson syndrome. Alright everybody, that's all we're going to talk about today with Metolazone or Zaroxolyn. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.